All right, thank you very much for the opportunity to present today. And I think Kristen set this up really nicely because one of her bullets in her presentation was about training practitioners in the field of One Health, which is what this will focus on. So today I am going to discuss a novel transdisciplinary One Health course, so both the creation and the implementation, that involved faculty from the colleges of Vet Med, the colleges of Public Health, and the colleges of Medicine. And I want to just draw your attention to my collaborators here because we all put in a significant amount of time. So Dr. Heidi Brown, Dr. Bonnie Buntain, and Dr. Julie Junberg, who is way up at the back, so you can talk with her after if you have questions as well. So with the unprecedented global emergence of One Health issues, academia is a key stakeholder in creating successful and sustainable solutions to those challenges that emerge at the ecosystem, environment, animal-human interfaces. And what we have is a very critical need for academia to support the training of graduates who engage in both interdisciplinary and transdisciplinary One Health in their professional practice, so going into practice and practicing as One Health practitioners in whatever field that may be that they're in. And I'm just going to pause for a minute and tell you our working definition of transdisciplinary for the purposes of this course. And that was engaging not only interdisciplinary, meaning professionals across our disciplines, but also teaching our students how when they go into practice that it's very important to engage their community members, their community partners from the inception all the way through to the program evaluation and reassessment of any One Health program. So to this end, faculty came from the colleges, as I said, from Vet Med, Public Health, and Medicine to create this pilot course to be offered to students as a pilot with the goal of expanding, but to offer to students from their respective colleges. So this course was offered in 2024 and 2025 as a transdisciplinary one-week intensive course. And we chose to use a team-based learning model. So this is a model that is used at the College of Veterinary Medicine. And we chose it because it promotes and guides student engagement directly with the materials. And it also uses a collaborative problem-solving approach, which is one of the key competencies of a One Health practitioner. We also chose to focus the course using a transdisciplinary One Health approach and using One Health core competencies as the scaffolding. And the goal of doing this was it allowed us to create activities and lessons throughout the week where the students could continually apply the One Health competencies that they're going to use in practice in a variety of different contexts. Oh, there we go. And so these are our learning objectives, and you can see they're pretty broad, but the main goals were for the students to understand a transdisciplinary One Health approach, and so they're able to, throughout the course of the week, apply the One Health competencies in a transdisciplinary One Health approach. This is an overview of our structure throughout the week. And so the first day, we started with an icebreaker because we were bringing students together from across a variety of disciplines. They were, as expected, a little bit nervous. So this gave them the opportunity to get to know each other a little bit and share their different perspectives from how they view One Health in their discipline. And we spent a large portion of the day talking about One Health so that this could create a strong foundation for the activities they would engage in the rest of the week. On days 2, 3, and 4, so Tuesday, Wednesday, and Thursday, we had a transdisciplinary topic of the day. So you can see the first day was zoonotic and vector-borne disease, and the first year was rabies, the second year was New World screwworm that we focused on. The second day was healthy rural environments. The first year we had them create a common green space for the community. In the second year, we had them use an inter and transdisciplinary approach to providing healthcare in a rural setting, so one of our primary issues right now. And on the third day, we did this as operationalizing One Health day, the fourth day, which would be Thursday. where they went back out into the community in the first year and engaged with community members as part of a program assessment. In the second year, we had them directly interact with practitioners in the field and do focused interviews to understand how One Health was applied or was not applied, which was some of the findings there, in practice. And then the final day, we very intentionally spent a large portion of the day focusing on feedback from the students, both to improve the course, but to understand how they grew or didn't grow throughout the course in terms of their perspectives on the One Health approach. And one of the other things I wanted to mention here is that we felt one of the reasons that this course ended up being successful from a teaching perspective was that we engaged as faculty, the four of us, from the creation through the implementation. So rather than a structure where we had one lead faculty member and then we had a series of guest lecturers come in, we engaged throughout the duration of the course. And so each of the transdisciplinary topic days, we had one faculty lead, but the other ones all had a role in that day so that we modeled to the students our own interdisciplinary collaborations. One of the outcomes of each of the transdisciplinary days was that the students created a deliverable. So they came to class prepared for the day with pre-work they had completed. They engaged in a variety of group discussions in interdisciplinary groups, so they were divided into groups with members from each discipline there, and we gave them a series of questions to work through. And then they had to create a deliverable. So for the first day in the second year, we had them create a deliverable for New World screwworm communication, which is, again, a very emerging issue right now. And this was one created by one of the groups for an audience of their choice, which were producers. And then they presented this to the other interdisciplinary teams at the end of the day. And that was something similar, a deliverable for each day of the course. This is a picture from the fourth day of the course in the first year. So we had students collaborate with the Arizona Department of Health Heat Relief Collaboration, and they were tasked to go out into the community and interview the administrators of organizations and facilities that were offering heat relief to the community members. And then they had to bring that information back and provide it to the Heat Relief Collaboration as part of their program assessment. We did, as I said, focus on student feedback. We did both qualitative and quantitative. And you can see here, this is from 2024 and 2025. In the light gray is, I don't think you can see my pointer. In the light gray is the pre-assessment. So these are self-assessments by the students. And in the dark gray is the post-course assessment. And we did this for a variety of different areas: One Health knowledge, their confidence in applying the One Health transdisciplinary approach, and their confidence in communicating One Health challenges to their peers, to the public, and clients. So broad objectives, but bringing them back to our course objectives. And you can see they all had pretty good self-assessments to start, which is not surprising because they're professional and graduate students, MDs, DVMs, PhDs, MPHs. But what we were pleased to see was that we did see a gain for each of the years in their comfort or knowledge in each of these areas. One thing I wanted to say about this too was this was backed up nicely by the qualitative feedback when we met with them in small groups afterwards. And we had a lot of comments about increasing their perspective or enlarging their perspective in how other disciplines view One Health, and also collaborating across disciplines and how to do that. And I think that's a really practical skill if you're asking people to work as One Health practitioners. We also, as faculty, spent a fair amount of time after the course reflecting on this because it was a big undertaking for us. And what we found, and a lot of these were not what I had ever imagined, but we really grew in our teaching and learning from seeing how the other disciplines both how they view One Health and how they teach One Health. We created strong professional and personal relationships, and this has been one of the primary benefits to me in that we've had a number of projects that have come off of this where now we're working together on different research grants and exactly what we talk about in terms of One Health collaboration, but we really saw it play out in practice in working together. We gained a much better appreciation for each other's disciplines and perspective, like I mentioned. And I think that the key here that I noted was that this was because we co-created the course, so we didn't do the guest lecture drop-in, and that's certainly a model that works, but we wanted to do something a little bit different, and this involved, a full amount of time from each faculty from creation through duration, so a full-time credit to do it all the way through technically is what it would have been. What we did, we also, I think one of the great outcomes was that because it worked so well with us as a team, we ended up modeling what we hoped our students would achieve in taking the course, which was a really nice outcome. What we did find, surprisingly, was considerable roadblocks, administrative roadblocks, in being able to deliver the course and create it. And one of these was course timing. So in professional programs, they're very structured. So VetMed has a very small window where they can do electives. Likewise, medicine does. They didn't align super well. And when they did, were available for, say, the medical students or the VetMed students, it was summer for the public health students, which is not an ideal time to be offering a course because students are off doing a variety of other things. Course credit, I think, was a roadblock as well, not just for us, but in general for doing these courses, because if you ask for faculty to engage on a full credit level for a course, you're engaging the full way through, but you're only getting partial credit because there's 4 of you working on this. That can be a challenge as well. And then finally, the incentive to co-teach, and that just comes back to what I just said. So you really need some support in being able to put your full effort into this if you are all engaged from start to finish. The factors we felt contributed to our success were an identified course lead, and what I mean by this was I was the course lead, and I was responsible for a lot of the logistics, so making sure we met, making sure things moved forward. So those types of pieces, you really need someone to drive that forward, even if content-wise you're all engaging from the creation onwards. The collaborative team approach, so being able to not only engage from the creation, but also during the delivery of the course, so we were all there every day engaging and offering our perspectives to model to the students. Faculty representation and active involvement from each discipline was important, so again, we all contributed to each of the topics every day, even though one person may have been the primary lead for that day. Regular planning meetings, and this goes back to the time commitment. This was the first year, I think we spent 9 months meeting weekly. And granted, we're in academia and we want to do things the best we can do, but it was a big undertaking, just getting used to each other at the beginning. In the second year, we were able to reduce this, but we still met probably 4 months in advance, meeting bi-weekly until we delivered the course. And then one of the key factors we felt contributed to the success was integrating the One Health competencies, so the students were applying One Health competencies in the activities they were doing and could carry that forward into their practices. In terms of next steps and suggestions, and these are broad suggestions for any university that would be engaging in an interdisciplinary and transdisciplinary course, is that we really need university leadership to allow faculty and encourage them to engage across disciplines. We need university administrative support for all those roadblocks in how we figure out the course timing and the credits. And I think probably several of you know, it's very common for administration in terms of colleges to work in silos, so it can be very difficult to do courses across disciplines. And then federal and state and university funding that supports not only research, which is a key component of One Health, but also supports the education and training of our practitioners, whether they're medical, they're veterinarians, they're public health practitioners, going into practice with a One Health mindset and practicing as One Health practitioners. And so because I have you as a captive audience, this is from my, I teach One Health in the vet med class, the vet med college, and these are my student One Health creation logos they do each year. Each group does it, and then they vote on the logo that will represent their class for the 4 semesters that I have them. And they're always amazing, and the detail in them, if you read the description, is wonderful. Like the little bow on the dog represents a very important piece of One Health, so I like to always share them, and you're welcome to click on the QR code and take a look at more of them. Otherwise, thank you very much, and I think we do questions at the end.